Hi, I am Priyanka Shokeen. I am working as a dietitian in Columbia Asia Hospital. Today I will give you some tips about heart healthy diet. Although you might know that eating certain food can increase your heart illness risk, it's tough to change your eating habit. Here are the heart healthy diet tips for you. Control your portion size. How much you eat is just as important as what you eat. Overloading your plate, taking second and eating until you feel stuffed, it can lead to eating more calories, fat and cholesterol than what you eat. So always control your portion size. Eat more of fruits and vegetables. Fruits and vegetables are rich source of vitamins and minerals, and they are very low in calories. Always use seasonal fruits and vegetables as they are good comparatively preservatives. Preservatives are high in sodium and potassium, and for a heart patient it is 100%, it is not recommended basically. Select whole grain. Whole grain are good source of fiber than other nutrients that play a role in regulating blood pressure. Always use whole wheat flour than the refined one, which is maida, as whole wheat flour contain good amount of fiber than maida. Always use wheat bran than white bread, because wheat bran contain again a good amount of fiber than white bread. Always use oatmeal, boiled corn instead of biscuits and popcorn and pancakes. So instead of that, always use those products which contain a good amount of fiber, as those things are better for a cardiac patient, for a heart patient. Choose low fat protein. Low fat protein here means lean meat, fish, poultry, all the dairy product, because they contain less amount of saturated fat than the red meat one, because red meat contain a good amount of cholesterol. So always choose a low fat protein sources instead of red meat. Reduce the sodium in your diet. Eating a lot of sodium can contribute to high blood pressure, a risk for cardiovascular disease. So always use herbs and spices instead of table salt, canned soup, prepared soup, soya sauce. So always use salt substitutes and herbs and spices, because that contain less amount of salt. Few of the vegetable and fruits also high in sodium, so always avoid those fruits and vegetables. Limit unhealthy fat and cholesterol. Limiting how much saturated and trans fat you eat is an important step to reduce your blood cholesterol and lower risk of coronary artery disease. A high blood cholesterol level can lead to build up plaque in your arteries called atherosclerosis, which can increase your heart attack risk and stroke. If you have further any queries or any doubts, then you can visit us on Lybrate.